we will do is we will check the pressure for you using our machines. We will have a look at the nerve ourselves. We will also do a scan of the nerve and also maybe put you on the visual field machine to have a visual field test like you saw just now. And this is the most important part of the talk, okay? Early detection and early treatment gives the patient the best possible chance of keeping their vision in their lifetime. The earlier we recognize the problem, the more vision we have to save. Okay, and that's very important because we are saving vision, we are preserving vision. For glaucoma, we cannot improve your vision, we cannot reverse what has been lost. So we cannot, it's all about prevention. And in order to try to reduce the risk of you losing more vision, we have to lower the eye pressure inside the eye. How do we lower the pressure? Now, we know that pressure is because of fluid in the eye circulating. You can either turn the tap off so you can reduce the fluid being produced inside the eye, or you can help the eye to drain fluid a little bit better. Okay, so there are a lot of ways to do this. And the easiest, the most convenient way to do this are eye drops. Eye drops are the easiest way to lower the pressure. Most of them are very safe and very effective. There are combination drops we can use to make it easier for patients. But the one thing about eye drops is once you start using them, they have to be put in every single day. And once we start the eye drops, they tend to be forever. We don't usually stop the eye drops unless you've had surgery. Eye drops are generally safe, but they can cause discomfort, redness, stinging, itching, and also some more serious side effects, but those are rare. These are the eye drops that I have at my disposal at IZKL. And you can tell at the top row, you have 1, 2, 3, 4 different types of eye drops. Okay, just ignore the bottom for a second. So usually we will start with one class first. And if the pressure is good, we leave it. If the pressure is not good enough, or if the condition is still getting worse, we will add another eye drop and then another one, and then another one. So you can see for patients who are possibly quite elderly, 70, 80, 90, if they have to use 4 different eye drops, it is a big problem for them. They can't squeeze the bottles, they can't remember, there's too many eye drops, and some of the eye drops are 2 or even 3 times a day. So to make it easier, we sometimes use the bottom ones to combine. So for example, we can combine the first and second one into 1 drop, the third and fourth one into a second drop. So instead of 4 eye drops, they're using 2 eye drops. So eye drops are a good, effective, and safe way of getting the pressures down. There is a second thing we can do, which is to use lasers. Lasers are mostly tasked with trying to either improve the draining of fluid from inside the eye, or we can reduce the amount of fluid being produced, turning off the tap. And it sounds horrendous. People think about laser, horrible, painful, blinding. It's actually not. What laser actually is a very focused beam of energy, which is applied to a very specific area to achieve something that we need to do. It is very, very safe. Usually very quick, about 5 minutes, 10 minutes. And the majority of lasers that we use for glaucoma are done in clinic, okay? These are different to the lasers you may have heard of for LASIK, correcting your power and things like using for diabetes. But by and large, we have different kinds of laser. The machines are usually quite small. We can move them around. And in the case of this laser, you can see this is just one of our clinic rooms. The patient is sitting here and the patient's face goes here, and we will numb the eye, and usually we will put a little lens, for example, onto the eye. Because the eye is a very small structure, the lens allows us to see a magnified view through these special mirrors, just allows us to see exactly what's going on, what we're doing, where the laser is going. So the laser is actually very, very precise, very focused, so it's very safe. Now, even though we are surgeons, usually as a glaucoma surgeon, I do not like to tell the patient they need surgery, because surgery, it means that the patient is really in trouble. It means that the eye drops are not working, the laser hasn't really worked, or they're not tolerating the eye drops, and they are still losing vision. So surgery is usually performed to help the eye to drain fluid from inside the eye to outside manually. We do it for them. There are a lot of different types of operations that we can do. And the more traditional ones are at the bottom here, trabeculectomy or a glaucoma drainage device. The traditional glaucoma operations are actually quite long. They can be 45 minutes to an hour to 2 hours, and they lower the pressure very effectively. But as you can tell, it's a very big commitment, because you're operating on the eye for 2 hours, the risks are a little bit more, and the follow-up, the recovery is a little bit longer. So in the last 5 to 10, maybe 12 years, we have had a new class of operations called the minimally or micro-invasive glaucoma operations, MIGS. These are operations which, instead of being 1 hour, 2 hours, they're about 10 minutes, and they're very safe, and they can be combined, some of them with cataract surgery. So there's a lot of interest at the moment with micro-invasive surgery, but not everybody is suitable for MIGS. And also, because they are quicker and safer, they don't actually reduce the pressures as much as the big operations, but not everybody needs the big operation to drop the pressure. So at Isaac, this is one of the micro-invasive procedure that I do. It's called the eye stent, and it basically inserts 2 very, very small titanium stents. And usually we combine this with cataract surgery. It only adds maybe about 5 to 10 minutes to the end of the cataract operation using the same incision with very little risk. And the idea is that we put these titanium stents into the draining system at the front of the eye. So this little brown line where the red arrow is pointing, this is called the trabecular meshwork. This is where the fluid from here, the inside of the eye drains. So when we put this stent in, it's like a shortcut, like a pipe that allows fluid to flow out of the eye a lot more easily. This is an example of a tube, a glaucoma drainage device. This can take anything from an hour to 2 hours to do. It's actually like a straw that goes into the eye and it takes fluid out of the eye. And you might notice there's a little string inside, because the worst thing that can happen after glaucoma surgery is not that the pressure is high, is that the pressure is too low. The operation is working too well. Glaucoma is all about balance. So we usually will block with the tube from the inside for about 6 weeks to 12 weeks and wait for the outside to heal up before we release the tube completely. So this is the tube operation. So that kind of summarizes glaucoma in a nutshell. I would like to speak about cataract very quickly now. What is a cataract? This is a clouding. So all of us have a lens, and I spoke about the lens earlier on. I showed you the picture. We have a lens inside the eye at the front and inside the eye. This is usually a clear lens when you are a child. It's a clear lens before the age of 40, 50. So your vision is always very good when you're young, right? So when you get to the age of 50, 60, 70, the lens starts to cloud over. And this can give you problems with blurring of vision, problems with reading, and also not just blurring of vision. If you have very early cataract, it can also cause things like glare. So when you're driving at night, the car headlights can be quite bright. You can't stand it. Or contrast issues. By contrast issues, what I mean is if the light level is a little bit low in the room, if it's not very bright, you struggle to see your phone. You struggle to see the small print. This can all be indications of early cataract. So once again, just to remind ourselves, that's where the lens is, okay? So this is what it actually looks like to me when I have a look into your eyes and you have a cataract. So this is actually, if I remember correctly, this is quite a young gentleman who was taking a lot of steroid tablets for a long time, so developed a cataract. So everything is supposed to be quite clear, but this white plaque is not supposed to be there. And as you can imagine, it's like me having a pair of dirty spectacles. It's all blurry for the patient. This is another fairly young patient actually who has a bit of cataract. So when I look into the eye, it's all supposed to be sort of nice, and the black areas are areas where there's no cataract, and this is obviously in the way. This is a very, very advanced example from someone who has been hit in the eye. So injuries can also cause cataracts to form. How common is cataract? Now, this is also a priority eye disease. It is thought to contribute to about 50% of global blindness, 50. It is the leading cause of reversible global blindness, so things that we can actually do something about to get the vision back. When I left the UK, we were doing about 350,000 to 400,000 cataract operations per year. So on a typical list for me, in the morning, for example, I would be doing about 12 to 14 cataracts in one morning. And in the United States, we estimate by 2032, we will be doing about, there will be about 40 million cataract patients by the year 2032, okay? What are the causes of cataract? It's pretty similar to glaucoma. So if you have, if your age is increasing, so if you're 20, 30, 40 years old, it's unlikely that you will have cataract unless you have an eye problem or you're on medication. If you are 50 and above in Asia, then there will be a little bit of cataract that's starting to form. When I was in the UK, we started to see them between 60, 70. So I think we do get them a little bit earlier in Asia. And I can't prove this, but I reckon it might be due to the sunlight, for example. If you have previous eye injuries, it can cause cataract. Previous eye surgeries can cause cataract. If you have other medical problems, for example, diabetes, it can cause cataracts. And it's the same with glaucoma, steroids. So if you are on any form of steroids, it can also give you earlier cataracts. So just be very careful about steroids. How do we treat cataract? Now, thankfully, well, first of all, the bad news is you need surgery. You need surgery for your eyes. There is no other medical treatment, no eye drops, no nothing that you can use to treat cataract. But thankfully, cataract surgery has evolved over the last 60, 70 years. In the past, we used to be, in the 70s and 80s, when you had your cataract done, you have to stay in hospital for 1 month, and usually done under a general anesthetic. It was a big thing. And nowadays, cataract surgery, especially, for example, at Isaac, you come in the morning, you will leave in the morning. You come in the afternoon, you will leave in the afternoon. This is a day case procedure now. There is no need for overnight hospital stay. Now, the amazing thing is, you might think, oh, operations on the eye, it's horrible. Actually, the majority of cataract operations, we actually just use eye drops to numb the eye, nothing else, no injections, no nothing. Occasionally, we still have to give you a small injection, like when you go to the dentist, but this is very rare. It usually takes 5 to 10 minutes, usually less. And also, there is a very high success and very high satisfaction rate. And now this is very important, a very important point to make. So it sounds like a small thing nowadays, but it's like when you're on an aeroplane going somewhere for your holiday. You don't actually see how much work the pilot puts in to try and plan everything, to check everything safely. It's the same with cataract surgery. You know, everything has to be planned and thought about by your surgeon. So they have to sit down, have a look at your eye, make sure there are no other issues, do a few investigations to check that there are no other problems. And also, the main thing that has to be discussed with the patient at this point is, what lens do we replace it with? Because when we take away the cloudy lens, it is standard practice to replace that lens, and I'll show you in a second. It's standard practice to replace that lens with a new man-made lens. Now, the beautiful thing about this new man-made lens is it can actually correct your power. Some of it can help, some types of lenses can help you read. So you may have heard of things like the multifocal lenses, the monofocal lenses. You may have heard people saying, I've had the best lens put in. I need to emphasize here, there are so many different types of lenses. There is no such thing as the best lens for you. There is only the most suitable lens for you. There is no such thing as the most expensive lens is the best lens. So when you put the wrong lens into the wrong eye, that's when people start having a lot of problems. So if you do ever find yourself having cataract, speaking to your surgeon, make sure that they know what lens is the most suitable lens for you. So for those of you who are a little bit squeamish about eye pictures, operations, this is probably the time to look away. I will be talking you through the cataract operation quickly and then showing you a video without me talking. So this is the eye when I look down the microscope. This is the view that I get. okay? And because the eye is small, we have to use a pair of microscopes. This is the lens. The orange lens is just from where the light is bouncing back from my microscope. You can see a cloudy patch here. This is the cataract. So we have to get into the eye with a little incision here. This blade looks very big, but actually this is only about 2.4, 2.2 millimeters, very small. And we don't actually remove the whole cataract. So once we're inside the eye, we will actually tear the front surface of the lens. We don't remove the whole lens. We make a little hole, and then we remove inside, and then it leaves a little bag, okay? And then we put the new lens back into the bag. So once we've torn a circle, okay, we would go in with some water to float the lens up, okay? Now, because the incision is very small, 2.2, 2.4 millimeters, but this thing is so big, how do we remove it? We have to break it up into very small pieces, and I'll show you later on. So we use this, which is an ultrasound probe, to break the cataract up, and then we suck everything through here out of the eye, okay? There we go, that's one piece being removed. Now, once the main part of the cataract has been removed, we will have to polish the rest of the bag, the empty bag that's been left, okay? Once that has been polished, now this is the lens that goes back into the eye. Now, because the lens is quite big, we can't insert it straight in. We used to do that. So in the old days where we do not, so the lens is now folded, okay? And it will unfold when we put it into the eye. In the old days, we used to make an incision which went all the way from one end to the other and just push the whole lens in. That's no longer the case. We will inject the lens, which unfolds itself, okay? And again, so this is a part where I show the actual video. I'm not going to speak. It summarizes everything that I've talked about so far about the cataract procedure. If you are squeamish, please look away. Okay, so you may have noticed that at the end, we do not use any stitching routinely. And after the operation, usually you will have some eye drops to use for about a month or so. I usually ask you to refrain from any heavy lifting or strenuous exercise for about a week. But usually the recovery is very quick, and a lot of patients come back the next day already seeing almost 20/20 vision. Okay, so moving on quickly to diabetes. This is a condition which affects the back of your eye. And it can be a complication of having diabetes. And the longer you have diabetes, the more likely you are to have problems with the back of the eye. This is because the high blood sugars will damage the retina, the important layer at the back of the eye, and the blood vessels. When the blood vessels are damaged, they can become blocked, they can become leaky, they can grow abnormally. And this is a problem because it can cause blurring of vision, it can cause loss of vision from bleeding at the back of your eye, it can give you black floaters, and it can also lead to glaucoma. So in the UK, if you have diabetes, once a year, you go for photographs of your eye, someone checks it, and if there's a problem, it gets sent to the hospital doctor. So it's the same thing here with glaucoma. If you have diabetes, your eyes need to be checked once a year at least by an eye specialist. They need to have a look for bleeding and everything else, okay? Again, it's listed as a priority eye disease. 5 million people are blind from it. This was 2002, so it's a lot higher now. It forms about 5% of global blindness. And amazingly, 50% of American patients with diabetes are not aware that they have problems with the eyes. This is the developed country. So think about the numbers here. How do we treat or how do we prevent and treat this problem? You have to first control your blood pressure and your blood sugar. Diabetes is a problem which affects all parts of your body. If you have uncontrolled blood pressure and sugar, you run the risk of heart attacks, strokes, kidney failure, and also eye problems. So you need to control all of this. If you have problems inside the eye from diabetes, usually we will use a combination of laser or sometimes injections into the eye, and also possibly surgery in the eye, for which we would usually ask you to see our subspecialist retinal colleagues. But the key thing is you need regular eye examinations if you're diabetic, so we can pick the problems up early and treat them and stop you from losing vision. This is a young lady who's had diabetes for quite a while. This is the optic nerve at the back of the eye. Blood vessels here. You can see these abnormal areas here in white, which are what we call cotton wool spots. These are areas where the blood vessels, the blood supply is not very good. Oxygen supply is very poor. You have a lot of abnormal bleeding spots also. And this is the center of your vision. So if it starts affecting this part, you will lose vision. So this is one of the biggest causes of visual loss in young working adults in the world. And these are laser marks which we have applied to the patient to try to get all these things to go away. And this patient has probably had about 3 to 4 to 5,000 laser burns. So just to tie everything up together, a lot of these common eye conditions are blinding. Okay, they are silent in the early stages. So please, early diagnosis and early treatment is important. If you give us more to work with and more to save, then you're more likely to keep your vision. It's important to get your eyes checked and your eyes screened if you have risk factors. It's the same as blood pressure and your usual annual health check. Do not neglect your eyes. Okay, thank you very much.
好，非常感谢我们的 Dr. David Woo 给我们带来这个对眼睛的疾病的这个意识醒觉哦。感谢 Dr. David。
Thank you, Dr. David Woo, for such an explanation. Yeah. So please do screening, guys. Early detection save your vision. Cataract is a 50% global blindness. Cataract causes 50% of global blindness. And also diabetes causes 5 million global blindness. That is very huge, huge statistic. Yes, Angie?
好 ，OK， 是的，真的是非常感谢 Dr. David Woo 刚才的分享哦，因为大家都知道，刚才通过 Dr. David Woo 的分享哦，我们知道，如果今天是有白内障、青光眼或者是糖尿病的话，很有可能就会让我们瞎掉，就是盲掉。那盲掉是非常非常痛苦的哦，所以大家一定要提早去做这个眼睛的检查，然后最好的是可以做预防，还有让你的眼睛做很好的保养哦。OK， 那现在我们趁 Dr. David 还有在的时候，我们来一个 group photo 好不好？好。
Yes, sebelum kita ke grup foto rakan-rakan, kita ingin berterima kasih show anda punya reaction kepada Dr. David Woo atas perkongsian beliau. Ingat ya kawan-kawan, pemeriksaan awal akan menyelamatkan penglihatan anda. Dan menurut Dr. David Woo, katarak adalah 50% penyebab buta di dunia. Dan juga diabetik juga menyebabkan orang buta, 5 juta manusia buta di seluruh dunia. Oleh itu, sekali lagi terima kasih kepada Dr. David Woo. Dan kita akan masuk kepada grup foto bersama Dr. David Woo sekarang ni. Guys, please switch on your video. We're gonna have a photo session with our specialist, Dr. David Woo. Please show your best smile.
现在请大家这个 video 给开上 ，turn on the video， 那我们就来一个团体的合照。我们可以比一个爱心哦。那非常的开心，大家今天可以参加这一个我们 Gummy Vzio 的 launching 呢，就是大家的眼睛还是可以看到的，恭喜大家！我们要非常感恩哦，我们还有这一个那么好的视力，可以让我们看到这个美好的世界哈。那这个时候呢，也请我们的公司的伙伴帮我们拍这个团体照，如果拍好了就给我们一个 hint 好吗？
Yes, I agree with you, Angie. We have more than 1,000 participants today, meaning to say that all of us inside here have a very good eyesight. That's why we can join this Zoom meeting with Dr. David Woo. And actually, for those of you who cannot join, no worry. We have Facebook live streaming for you all. Please click on Elkan homepage in Facebook and join us live there. Okay, untuk anda yang tidak dapat menyertai kita di Zoom meeting hari ini, anda boleh join di Facebook Live. Okay, dan kita sangat bertuah hari ini masih boleh bersama dengan Dr. David dalam Zoom meeting ini, bermaksud penglihatan kita masih lagi clear.
那在线上的朋友有1000位的朋友哦，那如果你们的朋友是上来的话，就让他知道在 Elkan 的 Facebook page 现在也是正在直播着，那他们就可以通过 FB 的直播观赏到今天的分享哦。
So Elkan staff, you guys ready with the photo? Please let us know. Smile until your face cramp.
拍好了，请让我们知道哦，爱看的伙伴。那真的非常非常的难得哈，今天 Dr. David Woo 在跟我们分享哦，刚才在他分享就是青光眼啊、白内障啊，还有糖尿病，其实这一些都是我们时常忽略的哈。尤其是我们家里的老人家，我们都不知道他看不清楚了。那有时候我们也是要多关心他们。我们家里的小朋友啊，现在都在上着网课啊，那他们的眼睛也遭受到很大很大的这个蓝光的伤害哦。所以我们真的是要趁早让家人们、让朋友们都做好这个眼睛的保养哦。
So thank you again to Dr. David Woo for telling us how important is it to do early screening, because as Asian and myself, I don't even do eye screening. That's the bad thing actually. So thank you once again. Keep on reminding us, Asian or Malaysian or whoever you are, please do your eye screening, because early detection really do save your eye vision, and most of us don't know we have eye problem until it's already up to the very, very late stage and where you can't help much. Alright?
Okay. 好的，那非常感谢我们的公司的伙伴们，已经是帮我们拍好了这个 group photo。那我们现在就以最热烈、最衷心的、真诚的感谢我们的 Dr. David Woo， 谢谢 Dr. David Woo。Once
again, guys, give a big round of applause to Dr. David Woo. Sekali lagi kita beri tepukan gemuruh kepada Dr. David Woo kita. Okay, Angie, after we'll all listen to specialists, what the specialists have to tell us. So what do we have next?
Okay.
Good news.
Yeah, Paul, you know, I just received a message from our management because our Zoom is limited to, now is limited to 1,000. So we are going to have a new Zoom link for everyone to join in. So shall we take a 15 minutes break for now? So after 15 minutes, everyone join in again.
Alright, I think that's a good idea. Untuk Anda yang berada di dalam ini, so kita akan buat break selama 15 minit untuk Anda join semula sebab kita akan upgrade sebab kita punya participant hanya mampu sampai 1,000 saja. Kita akan upgrade untuk Anda semua join kembali. Okay, so get your friends to join again. We'll have our break in 15 minutes. Can please join back again and we'll admit all of you again until we can reach the maximum packs.
Yes, 好了。对线上的朋友们，非常感谢大家的踊跃参与。那由于我们这个 Zoom 的 link 要 upgrade 去更多人，让更多人可以加入呢。那现在我们有一个15分钟的 break 的时间，所以待会儿15分钟大家再进来就可以，所有的朋友都进来了。那因为我们今天报名的朋友有超过1500位啊，所以我们希望每一位朋友都可以进来，因为等一下我们还有一个非常劲爆的分享，我们还有幸运抽奖啊，这个是大家也非常期待的哈。所以呢，现在是3点20分，我们3点35分再进来好吗？线上的朋友。
Okay, untuk Anda semua kita akan ambil masa 15 minit untuk rehat. Selepas tu anda please join semula kerana kita akan participate, masukkan lebih ramai orang lagi dan jangan tidak masuk sebab kita ada purchaser draw, lucky draw untuk anda menangi. Yes, yeah, we have purchaser draw, we have lucky draw waiting for you guys to win. Please join us back again after 15 minutes. We'll see you guys in 15 minutes. See you guys.
Yeah, see you guys. 我们3点见喽。OK， 拜拜，再见。